All right.
Have to see each other there?
No, I was about to check phone and see where that.
Might be a good idea.
Okay, so tonight we're going to cover vital signs and chapter 1. And if we have time, because we're scheduled to be here until 9, we'll start in on chapter 2. We're going to take a break between vital signs and chapter 1, at least long enough for me to pause the camera, because my intent is to upload these in sections. So I'll upload the vital signs video and label it vital signs, and then I'll upload chapter 1 and label it chapter 1. We'll see how it works. I hope it works. I hope you guys can find my channel. Mariah found it and subscribed. Somebody else did too. I don't know who, because it doesn't tell me who. But so when you think about vital signs, what comes to mind?
Pupil dilation.
Okay, pupils are a good vital sign, but they're not one of the 6 that we need to think about for every patient.
Pulse.
Pulse.
Pulse, respiration,
Okay, so we have pulse,
skin temperature,
we have respirations. I'm going to put skin way over here.
color,
Pardon?
color,
Okay, so skin, color, temperature, and condition, that's all going to go underneath skin. What else do we have?
blood pressure,
Blood pressure, good.
temperature,
Skin, color, temperature, and condition are all going to go right there.
airway,
Okay, airway is something that could potentially be a life threat, so we'll put it over here and maybe deal with it later. What's the difference between a sign and a symptom?
sign is something you can see, a symptom is something you're told.
Okay, so a sign is something that you can see or measure, and a symptom is something that you're told. So a sign is objective, and a symptom is subjective. So because signs are objective, we're looking for 6 things that we can independently measure.
Level of consciousness,
Okay, level of consciousness. How about capillary refill time
okay,
and SpO2? Okay, so when we measure each of these 6 things, pulse, respirations, blood pressure, capillary refill time, skin, and SpO2, we report on different things. Now, the things that we report on vary depending on which one of the vital signs we're reporting on. So if we're going to look at pulse first, what's one of the things that you always report on pulse?
Beats per minute.
Beats per minute, or rate, right? So for pulse, we're going to report rate, or beats per minute. Okay. What's another thing that we're going to report on for pulse?
character.
Pardon?
Character.
Character. How can you explain that in a different word or different phrase?
Well, if it's regular or irregular.
Okay, so we're going to report on regularity. So when you report this, it's either going to be regular or irregular. Right? Pretty simple. What's the last thing that we're going to report on for pulse?
Strength.
Strength, yeah. We're going to report rate, strength, and regularity. And strength has all sorts of things that go along with it. It can be strong, it can be weak, it can be bounding, it can be thready. Why do you think that pulse is a vital sign that's important enough that we included it in this list?
Because if you have no pulse, then you're pretty much dead.
Yeah, if you don't have a pulse, then you're going to be dead, right? What else can the pulse tell you? First, what's the normal pulse rate for an adult?
50 to 70 beats per minute.
No, it's 60 to 120.
60 to 100. Yeah, 60 to 100. So the normal pulse rate for an adult is 60 to 100. So if their pulse rate is a little slow, their heart may not be beating as well as it should, right? And I say may not because each person is an individual. So while the normal pulse rate range is 60 to 100, your pulse may normally be a little lower than that. if your pulse is above 100, if your pulse is above 100, that's kind of odd. Okay, it happens. What types of things could happen to a person to make their pulse rate go above 100?
Shock.
Shock. So when a person goes into shock to start with, they're going to get an increased pulse rate, an increased respiratory rate, and an increased blood pressure, right? While they're still in compensated shock. So shock is a good one. What else?
Fright.
Fright. What else?
Exertion.
Exertion. Good. Injury. You know, any number of things can cause the heart rate to go up above 100 for however long it takes for the body to recover, because we have that fight or flight response, and because of fight or flight, we really want to run, right? We want to run or we want to fight with somebody. And so our heart rate increases so that we can make sure we're getting oxygen to the parts of our body that we need to in order to run or fight, okay? All right. How about respirations? There's a lot of things that we cover in respirations. What do you think the first one is?
How many?
Rate. Yeah, so we're going to have a rate again. And that's reported in breaths per minute. Or RR. Okay? Respiratory rate. Yeah, RR means respiratory rate. What about effort? Oh, what's the next one? Oh, it's effort. I hope that they can see this marker up here. I should be looking
Green
at it.
actually may not show.
Is it visible? The green one might not show?
Well, actually, I think
Sorry, I'll use a different color next time.
that's it. Yeah.
All right, so we have effort, okay? What do you think someone who is breathing effortlessly looks like?
You breathing right now?
Me,
Man,
you.
Like I have a problem.
What about someone who has some effort with breathing or is struggling to breathe a little bit?
Large chest rise and fall.
Yeah, we're gonna see visible chest rise and fall. What else might we see?
Straining, like in their neck, possibly.
Okay, we could see some
Visually
straining in their neck.
face, They might posture their lips. They might
Yeah,
posture
they
their
might have
body.
pursed lips. They might be leaning forward in a tripod position, either on a chair or just forward standing like this. What else might we see?
The use of muscles.
Muscles. And what are our muscles going to look like? What's going to happen?
Well, they're going to be tensed.
They're going to be tensed, but if you breathe in super, super hard, you're going to see retractions, okay?
Oh yeah.
Yeah, so you're going to see retractions right here. You're going to see retractions in their chest wall, in their intercostal spaces, okay? And those retractions are going to last until they go into respiratory failure. So those retractions are a sign of respiratory distress. They're going to last until they go into respiratory failure. Once a patient goes into respiratory failure, their muscles are going to be too fatigued to continue with retractions. Okay? So we're going to see some effort there. And when we see that effort, we're going to report it as effortless, or we're going to describe whatever it is that we saw for their effort. One thing that's fairly visible and shows a lot of effort is nasal flaring. Okay? If their nostrils are flaring wide open, they're trying to get as much air as they can in through their nostrils, right? So we're going to see nasal flaring. So we are either going to report our respirations as effortless, or we're going to report them with whatever the symptom of the effort is that we saw. If we see nasal flaring, if we see retractions, if we find our patient in a tripod position, whatever it is, that's what we're going to put there. How'd you get lucky enough to not be on shift today?
I am on shift today.
Oh,
I'm just here. We had enough people to cover the station, so they let
Oh.
me go.
cool.
Yeah.
That was nice of them.
That doesn't happen often.
All right, so we have rate, we have effort. What else do we have? 3 more things. How about regularity? Think we have regularity in respirations? And we're going to report those as regular or irregular. Some of the types of respirations that can cause and irregularity are Cheyne-Stokes respirations. When we get to airway, we'll cover this a little bit more, but we've got Cheyne-Stokes respirations, we've got Kussmaul respirations, we have agonal respirations. There's a couple of different breathing patterns that we're going to learn a little bit more about later. So when we report regular or irregular, if you can recognize a pattern with it, that's good. And then you can report that pattern instead of just saying regular or irregular. What is the normal respiratory rate for an adult?
12 to 20.
12 to 20. 12 to 20 is the normal respiratory rate for an adult. If they're breathing a little slower, is that okay? Yeah. If they're breathing a little faster, is that okay? Yeah. At what point do we think that they have a problem?
If they're out of their range or if they're showing some other difficulty associated with where they're at.
Okay, if they're way outside of the range or if there's other difficulty that's shown there. So one of the other difficulties that we might see is a change in depth. Okay? Your depth is normal, shallow, or deep. Now, if a person has a respiratory rate of 10, but their respirations are deep, do you think that they're breathing okay? No? Why would you say no?
Well, it depends on the condition you find them and what they're doing.
If their respiratory rate is 10 and they're breathing shallowly, are their respirations okay?
No, they're not getting the tidal volume.
They don't have the right tidal volume. So the rate is important, but it's really only important as related to depth, effort, regularity, etc. Now, the last thing that we cover in respirations is quality. What do you think quality means?
How much oxygen they're actually getting when they take a breath?
That's a really good guess. And it's almost related to that. But it's actually, how do their respirations sound? Are we hearing sounds with their respirations? Do we hear wheezing? Is there no noise? Is there wheezing? Is there stridor? Do we have crackles? Do we have rails? So when we report quality, we report it as unremarkable, or we report the sound that we're hearing. Wheezing, stridor, rails, crackles, etc. Make sense? All right. Now we're going to talk about blood pressure. Blood pressure is a fairly simple one because we only report two numbers. It's one of the hardest ones to learn how to obtain because people think they've got a correct blood pressure when really they're watching the needle bounce, and that's when they start counting instead of when they actually hear the pulse come through. So we have to learn how to do vital signs, and we're going to learn how to take blood pressure tonight. Some of you probably already know. You probably already know how to take blood pressure, but we're going to work on it tonight, okay? So what is the normal blood pressure for an adult?
120 over
120
80.
over 80. You're giving me a dirty look.
No, I'm not.
120 over 80. Okay. And what is that top number?
It's your systolic.
Yeah, it's your systolic. And what is systole?
Systole.
I know the number.
I was going to answer you, but the question that you posed isn't what I was ready for. But your systolic is what is your heart under compression. That's going to be your strength.
Right.
Your high pressure.
Yeah.
That's
So systole
contraction.
is your ventricular contraction. Okay. So systole is the measurement of the pressure against your arterial walls during the contraction of your ventricles. to measure blood pressure against your arterial walls and not the walls of your veins? Anyone?
Good question.
Anyone want to take a guess?
Well, I know the walls of your arteries and such change for various reasons.
Yeah.
It's like when you go into shock, sometimes they dilate. You
Mhm.
lose volume, systemic volume.
So the walls of your arteries are the only part of your system, the only part of your circulatory system, besides the heart, that has muscle that helps it along. Okay? Your veins are not under pressure. When blood returns to your heart, there are valves in your veins, and as the blood goes back, more blood, let's just follow the blood from our heart. Our left ventricle pumps out to our body. We wind up with blood down in our feet, and the only way that blood returns to our heart is because our heart is still pumping blood out. So instead of pooling in the bottoms of our feet, the blood gets pushed back up when more blood gets down there. And it can't slide back down because the valves inside the veins close and keep the blood from sliding back down. Okay? There's no pressure in your veins. There's no way to measure that pressure because there is no pressure. Have you ever tried to stop a vein from bleeding? It's pretty simple to stop a vein from bleeding, right? Capillary bleeding, venous bleeding. When you try and stop when you try to stop your heart from bleeding, when you try and stop an artery from bleeding, you have a lot more pressure there because it's coming from your heart. We couldn't measure venous pressure, not with the materials that we have that we're allowed to use. So we measure arterial pressure as a measurement of how well the heart is functioning. Okay. If the top number is systolic, what is the bottom number?
Systolic.
What is it?
Dystolic.
Diastolic. Yeah, diastolic. And what is that a measurement of?
It's the pressure when it, I know when you take blood pressure, you don't hear it anymore. I don't know what it represents, though.
So if this is a measurement of ventricular contraction, what do you think this is a measurement of?
When it stops contracting.
Ventricular relaxation.
During relaxation, yeah. So this is a measurement of the pressure against arterial walls during ventricular relaxation. So this entire statement right here, just pretend I rewrote it right here. Okay. Your blood pressure is a pretty important clue to how your patient is doing. When we're dealing with a patient who is in compensated shock, what are we going to see? What is our blood pressure going to do?
Well, it's like you said, at first, because of the flight or fight response, everything could be elevated.
Right, everything's going to be elevated for a little while.
That's only going to last for a while, and
Yep.
then you're going to start to slowly crash.
That's correct. In some cases, in some types of shock, obstructive shock, for example, and we'll learn more about types of shock, I think it's chapter 7, or chapter 12. In some types of shock, our first indication that there's something wrong is when our pulse pressure, this gap between systolic and diastolic, when it starts to narrow. Okay? When we stop having 120 over 80, we start having 135 over, or 130 over 96. 132 over 100. So our pulse pressure, that gap in between here, starts to narrow. That's a sign that there's something wrong around the heart, obstructive shock. Okay? So blood pressure and understanding how to take blood pressure is super, super important. When we measure blood pressure, we use a sphygmomanometer, a blood pressure cuff, and we use a stethoscope. Sometimes you're going to be in a situation where you can't hear blood pressure, right? When you're out in the field, it's dang hard to get blood pressure if you're trying to auscultate. What does auscultate mean?
Listen.
Means listen, yeah. So it's dang hard to get blood pressure if you're trying to listen and there's sirens and firemen are cutting on cars and people are talking and you're having radio chatter. It's really hard to listen. So sometimes when we measure blood pressure, we measure it by palpation. So we have two ways to measure blood pressure. We measure it by auscultation, which means we use our stethoscope to listen. And the other way we measure it is by palpation. What does that mean?
Feel.
Yeah, that means we use our hands to feel. How do you suppose we measure blood pressure by palpation?
Put your fingers where you would normally put the stethoscope.
You can put your fingers where you normally put the stethoscope or on your radial pulse. So I want you to try and find your radial pulse with 2 fingers. It's pretty simple to find. It's on the lateral side of your wrist. Did you find it? Everybody found it? Okay. If you were to inflate a blood pressure cuff on your arm until your radial pulse went away, and then you allowed some of the pressure to slowly flow out until you felt the radial pulse again, at the point that you feel your radial pulse again, whatever that number is up here, that is your blood pressure by palpation. So when we report that, we report it as systolic over palp. Questions so far on our vital signs?
How accurate is that?
It's not terribly accurate, and it's not used so much for accuracy as much as it is for trending. Now, if you have a patient who you can't find a radial pulse in, you know that that patient has a systolic pressure of less than 90. Okay? So in order for them to have a radial pulse, we're going to just erase some of this stuff up top here just for a minute. In order for them to have a radial pulse, they have to have it's a systolic pressure of greater than 90. Okay. In order for them to have, and this radial pulse equates to your pedal pulses, posterior tibial, dorsalis pedis, those pulses. Okay. In order for them to have a brachial pulse or a femoral pulse, it equals a systolic of greater than 70. So if you're looking for a pulse and you can't find it, then look for the next one up. Okay. If you can't find a brachial or a femoral, but you can find a carotid, it equals a systolic of greater than 50. So if you cannot take a blood pressure because you can't hear, because you don't have a stethoscope, because you don't have a blood pressure cuff, you can get a pretty good idea of where your patient's systolic blood pressure is by where you can find a pulse at. All right. We are going to put capillary refill time underneath there. Capillary refill time. How do we report capillary refill time? This one's pretty simple.
Good or not good?
Well, 2 seconds.
Yeah, we report it as greater than or less than 2 seconds. Where do we measure capillary refill time at? In your nail bed. In your nail bed. So if you are going to check your own capillary refill time and you push down on your thumb or your finger and you watch it and it goes from being white to being pink rapidly, as it should, then you know that your capillary refill time is less than 2 seconds. What does a capillary refill time of greater than 2 seconds mean?
The person is not perfusing well.
The person is not perfusing well. What is perfusion?
Oxygenation of blood.
Oxygenation of blood. More importantly, perfusion is the body's ability to get that oxygenated blood to the tissues and organs that need it. Okay? So perfusion is that process, the process of getting that oxygenated blood to the tissues. So if you are checking your capillary refill time and it is greater than 2, your body isn't getting your blood where it belongs, right? Okay. As I said, this one's fairly simple and is reported fairly simply. Now, what about skin? 3 things that we measure on skin. We already covered them earlier. What are they?
Color, temperature.
Color, temperature, and
presence or non-presence of sweat.
Texture.
so we're going to call that
Diaphragm.
condition.
Condition.
Yep. And condition has everything to do with moisture. So when we talk about color, what are the normal colors that we see with skin?
Pink.
Pink. Where are we going to check these colors at?
Inside your lip.
We can check inside our lip for people who have a higher than normal level of, for people who have a higher level of melanin, right? So people who are of African descent or Asian descent, they may have a higher level of melanin. That's why their skin's a different color. So we have to check in different places. You can look at me, and I feel a little bit hot right now, feel a little bit flushed. So you can look at me. I know I have my jacket on. Got it. Thanks, kid. But you can look at me and tell that I'm pink, right? So pink is a color that we normally see. What are colors that we don't like to see?
White.
White?
Yeah,
Or
like
gray.
pale.
Pale? Good. What else? Red, somebody said? What else?
Gray.
Gray?
Blue.
Blue. What does blue indicate?
Lack of oxygen.
Lack of oxygen. It indicates cyanosis, right? Cyan, by the way, means blue. So when we get to our medical terminology chapter and we're having fun little medical terminology games, there you go, there's your freebie. Okay. What other colors might we have? What about yellow?
Jaundice.
Right.
Can we have purple skin?
Yeah. Bruising.
Okay. Pretty much any color that you can come up with, you can probably have some type of something that goes along with it, right? In my high school class today, we were talking about what people can consume that changes their skin color. One of the things they can consume is silver, right? And that's just not cyanosis blue. That's like your entire body turns blue.
Why would people consume silver?
They like it? I don't know. I don't know.
Okay.
All right. What about temperature? If you were to touch me right now, what would you say my temperature is?
Probably warm.
Warm, right? We aren't going to get too specific when we're reporting this vital sign. So we have warm, we have cool, we have cold, and we have hot. Okay, that's really all we care about. Warm, cool, cold, hot. Pretty simple measurement. And what are we going to do when we talk about condition? What are some of the things that we're going to report there?
You're diaphoretic.
Diaphoretic.
So sweaty.
So we're going to report diaphoresis. We also might say that a person is clammy. What do you think my skin condition is right now?
Your hands
Is
are
it-
dry.
Dry. It's dry.
You're not clammy because you're on camera?
Okay, so we have diaphoresis, we have clammy, we have dry. What else do we have? Anything? Are we missing anything?
I don't know.
All right. SpO2. What does SpO2 measure?
Amount of oxygen in the blood.
The amount of oxygen in the blood. Does it work all the time?
No.
No. Why not?
If you're very cold, the sensor will not necessarily do well
Okay.
on your fingers, so you go to the ear.
Okay, so if you're cold, it messes with it. What else might mess with it?
Moisture.
So if you're a smoker, that changes things.
Fingernail polish messes with it. What else messes with how an SpO2 monitor works? Well, let's ask this question first. How does an SpO2 monitor work? What does it do?
It measures the color of the blood.
Measures the color?
I think so.
Any ideas? Okay, let me grab an SpO2 monitor and we'll play with it just for a minute. It measures the oxygen saturation in the blood and it reports it as a percentage, right? So how the SpO2 monitor works is it looks at these little things on your red blood cells that carry oxygen. What are those called? What's it called?
Red blood cells.
The red blood cells carry oxygen because the oxygen attaches to what? What does the oxygen attach to in the red blood cell?
Well, I want to say hemoglobin.
You're right, it attaches to the hemoglobin. Oxygen attaches to the hemoglobin in a red blood cell, okay? Because the oxygen likes the red blood cell, likes the hemoglobin, and it says, oh, hemoglobin, please come with me. I'd like to take you on a date. May we? Let's go. And so the hemoglobin and the oxygen travel together throughout the body, right? Okay, what happens when carbon monoxide comes along?
Has an affinity for hemoglobin.
Yeah.